Let's move on to our next story for today. Now, have you wondered how the physically challenged in the country are coping with the lockdowns, partial restrictions, and the spread of coronavirus? In the midst of the pandemic, these people are now at a double disadvantage, and for some of them, getting by has been quite challenging. So what is the government doing to ensure that these people are safe and are provided with their needs? Just Nigeria's Abayomi Adisa has been finding out.
Life, as we know it, is no longer the same. The COVID-19 pandemic has created a new normal way of living, and many states in the country have had to lock down for weeks. And like many vulnerable groups, people living with disabilities are struggling to adapt to the new normal.
In Nigeria, there are more than 20 million disabled persons. Some of them live in dire situations. Before the lockdown, they had no formal means of livelihood and they depended largely on handouts from people to live. Today, they lack access to basic supplies and are almost running out of options.
Moninuola is widowed and visually impaired. Her husband, also visually impaired, died in February after a brief illness. Moninuola and her children were still mourning their dead when the lockdown restriction was ordered in March. She says life has since then become hellish. Though she's scared of contracting the virus, feeding her 2 kids is her biggest worry. They live every day as it comes.
I sell sachet water, and the little sales I make is spent on feeding myself and my children. As I speak to you, I haven't sold anything, and it's some minutes past 1 o'clock in the afternoon.
Live from the Max FM.
Victor is a newsreader and editor in a popular radio station in Lagos. He says his employer made the lockdown experience easy for him, but fears others may not have had it as good.
It's a difficult time for many visually impaired, especially those who do not have assistance, especially those who don't have a viable means of livelihood, especially those who are not just blind or visually impaired, but also have, some underlying conditions.
The longer the lockdown.
Dr. Adebayo is the chairman of Joint National Association of Persons with Disability, Lagos chapter. He shares what he describes as the reality of people with disabilities during the lockdown.
An everyday person with disability has no means of livelihood. First, they can't do anything for themselves, and then those that they now rely on have also been, badly hit by the COVID-19 crisis.
Health authorities recommend frequent hand washing hygiene to prevent COVID-19, but some disabled persons still lack access to sanitary materials.
Getting sanitizers these days is not what you can get, affordably. Masks are becoming, more expensive, and it's looking like, the lockdown would even be extended. It could even be extended. So if it's extended, then it means, again, that the panic buying would start. The hoarding would begin. And for them, it will be a challenge to access the materials.
In April, the federal government announced cash transfers to 3.6 million poor and vulnerable households. Later in the month, 70,000 metric tons of grains were reportedly approved for distribution in Abuja, Lagos, and Ogun states. But some disabled persons claim they still haven't got these palliatives.
I truly heard about the palliatives, but I have not received anything from them as a blind widow. They haven't come to my neighborhood.
I've spoken with a couple of people, and what they've said is they've not been able to get any of the palliatives, despite the various organizations that have to do with the blind and visually impaired.
Lagos, the epicenter of COVID-19 in Nigeria, has at least 2 million residents living with one form of disability or the other. The authorities have also distributed palliatives to vulnerable residents, but Dr. Adebayo says only about 6,000 disabled people have been reached so far.
We've reached about 6,000. But you and I know that 6,000 is just a drop in the ocean when you compare to the nearly 2 million PWD population we have here in Lagos.
He blames the authorities for lacking coordinated approach for reaching persons with disabilities.
If we have had a planned approach to engaging, we have an agency, Lagos State Office for Disability Affairs in Lagos, which should of course have documented the huge population of PWDs in the state, and of course through them we will have been reaching out, to more than the number of persons we have reached so far.
Gbenga Omotosho is the Lagos State Commissioner for Information and Strategy. He says the government is scaling up efforts to further address their needs.
The people living with disability, we have their addresses and we have contacted them. Many of them have gotten the package and they are very happy. We will continue to address the issues that we have seen, and that is going to get better.
As coronavirus continues its disruptions, people living with disabilities hope that authorities will develop a database that will adequately capture their community, involve them in planning emergency responses, and alleviate their sufferings. Abayomi Adisa, Gist Nigeria.
The plight of people living with disability in the face of COVID-19. There's more to come here on Gist Nigeria from the BBC and Channels TV. With the lockdown partially lifted, we bring you some tips on how to practice social distancing at work. That story is right after this. Stay with us.